Hello, welcome to this segment of Code Rhetoric with Tam Talk. Today we will be focusing on hypertensive chronic kidney disease, which can be located in the circulatory system, Section 1, Chapter 9. Our ICD-10 General Code Line states, for hypertension or hypertensive chronic kidney disease, assign codes from category I-12, which represents the hypertensive chronic kidney disease, when both the hypertension and a condition classifiable to category N18, which represents the chronic kidney disease, and may also be written as CKD, are present. CKD should not be coded as hypertensive if the physician has specifically documented a different cause. The appropriate code from category N18 should be used as a secondary code, with a code from category I-12 to identify the stage of chronic kidney disease. Side note, if a patient has hypertensive chronic kidney disease and acute renal failure, an additional code for the acute renal failure is also required. So the ICD-10 General Coding Guideline further states, the classification presumes a causal relationship between hypertension and heart involvement and between hypertension and kidney involvement, as the two conditions are linked by the term with in the absence of provider documentation explicitly linking them, unless the documentation clearly states that the conditions are unrelated. So in other words, we are to assume that the hypertension and heart involvement, as well as the hypertension and kidney involvement, are the causal effect or has a causal relationship between the two. If not, then the provider documentation has to specifically state that either diagnoses are unrelated to each other. And the guideline further states, for hypertension and conditions not specifically linked by relational terms such as with, associated with, or due to in the classification, provider documentation must link the conditions in order to code them as related. So here in our first coding example, our patient presents for management of hypertensive heart and chronic kidney disease with stage 5 chronic kidney disease or end-stage renal disease. So in our first book step, we're going to identify our main term, which is hypertension. From hypertension, we're going to drill down to cardiorenal, which represents the kidney as well as the heart. Then we're going to drill down further with stage 5 or end-stage renal disease. So with the different kidney stages, stage 5 as well as end-stage renal disease have the same ICD-10 code. So based upon our drill down or our book steps, our first ICD-10 code is I13.11. And when we go to that code in our tabular list in the back of our ICD-10 book, there are further instructions. And the first one is to use additional codes to identify the stage or chronic kidney disease, which is represented by ICD-10 codes N18.1 through N18.4 and then N18.9. So then in our second book step, which we're going to identify our end-stage renal disease or stage code, our first main term is disease, then we're going to drill down to renal, then we're going to go to end stage, and then our ICD-10 code should be N18.5. And so our rationale is the patient presented with hypertensive heart and stage 5 or end stage chronic kidney disease. And so per the coding guidelines, we are to assign an additional ICD-10 code to identify the stage of chronic kidney disease. So based upon the patient's diagnosis, the coder should assign primary code I13.11, again, which represents the hypertensive heart disease, and then secondary code N18.5, which represents the stage of the chronic kidney disease. In our second coding example, we have another patient who presents for management of hypertensive heart as well as chronic kidney disease. However, in this case, the chronic kidney disease stage is 1, and the patient also has a diagnosis of acute renal failure. So in our first book step, we're going to identify our main term in the coding index, which is represented by hypertension. Then we're going to drill down to cardiorenal, and then further drill down to stage 1 renal disease. Our ICD-10-CM code should be I13.10. Again, when we go to that code, there are further instructions for us to identify or use the ICD-10 code for the stage of chronic kidney disease, again, which is represented by ICD-10 codes N18.1 through N18.4, as well as N18.9. The guidelines also further states that we are to use an additional code to identify the acute renal failure. So in our second book step, we're going to locate disease in our index, and then we're going to drill down to renal, and then we're going to identify the stage of the renal disease as stage 1. Our ICD-10-CM code should be represented at N18.1. And then a third book step, we're going to locate or identify our main term, which is failure. Then we're going to drill down to renal, and because the provider specified that the renal failure was acute and not chronic, we're going to drill down further to acute. And therefore, our ICD-10-CM code is represented by N17.9. So again, in our rationale, the patient presented with hypertensive heart disease as well as chronic kidney disease with acute renal failure. And our stage for the chronic kidney disease is stage 1. So per our coding guidelines, we are going to assign an additional code to verify the stage of the chronic kidney disease as well as acute renal failure. So based upon the patient's diagnosis, the coder should assign primary ICD-10 code I13.10, secondary code N18.5, and then tertiary code N17.9. So with our coding tips, our first one, we want to ensure that we're capturing the entire diagnosis. So with hypertensive heart disease as well as chronic kidney disease, we want to ensure we're capturing the entire diagnosis and not just capturing one part or one or the other diagnosis. Secondly, remember to always incorporate your CKD stages. Again, when you're coding hypertensive heart disease along with chronic kidney disease, the guideline further states that we are to assign the CKD stages. Thirdly, pay close attention to your ICD-10 coding guidelines, as well as, again, the additional or inclusion notes located in the tabular list, which is located in the back of your ICD-10 book. Remember to code to the highest specificity. Always remember to code to the highest specificity. And lastly, when in doubt, always reference your coding guidelines or query the provider. This concludes our segment of Code Rhetoric with Tam Talk. To learn more, please subscribe to our YouTube channel at Abraham Medical Coding Coach Abraham, or visit our website at www.abrahammedicalcodingcoachllc.com, and be sure to follow us on Facebook, LinkedIn, and Instagram. Thank you.